Do not be intimidated. I'm just going to talk about ABGs in this video, and then I'll make a separate one about fluid and electrolytes and stuff like that. Okay, so ABGs, arterial blood gases, they're going to be drawn from the artery. In most hospitals that I've worked at, especially in Florida, the respiratory therapist is the one that draws them, and then collectively, you, the respiratory therapist, and the doctor interpret the values to be like, oh, are they in acidosis? Are they in alkalosis? Is it respiratory? Is it metabolic? How are we going to fix this stuff? So, I almost said... Okay, the best way to do it is to learn Rome. Respiratory is opposite, metabolic is equal. That means that the value that they're looking at and the pH are going to be either opposite if it's respiratory or equal if it's metabolic. If it's respiratory, we're looking at the CO2, we're looking at the carbon dioxide. If it's metabolic, we're looking at the bicarb, which is HCO3. All right, so in respiratory blood gases, you are looking at the pH. If the pH is high and the carbon dioxide is low, you're in respiratory alkalosis. If the pH is low, but carbon dioxide is high, or PCO2 is high, you are in respiratory acidosis. Now, opposite, if the pH is high and the bicarb is high, you're in metabolic alkalosis. Now, if the pH is low and the bicarb is low, you're in metabolic acidosis. And then, oh dear, you have something to fix. I hope this helps.